everyone. Welcome to the National COVID-19 Prioritization session. Thank you all for being here in person and virtually. Transplant patients are among the most vulnerable to severe outcomes from COVID. That was true at the beginning of the pandemic, and that still remains true today. Immunocompromised people now represent about 25% of all COVID and related hospitalizations, despite being a relatively small population. Both hospitalization and mortality rates today are higher for transplant recipients than the rates for the general population at the beginning of the pandemic, before vaccines, when these rates were considered an international emergency. So some disclosures before I continue. We do have shared study funding with Health Canada, AstraZeneca, University Health Hospital Foundation, FRQS, and Transplant Research Foundation of British Columbia, CIHR. And I want to disclose and thank those funding partners. Without them, we wouldn't be able to treat COVID as a study. And there are no other relevant conflicts. Would like to highlight the objectives for Treat COVID, which is a national cross-country questionnaire study. The objectives are: we hope to assess COVID-19 prophylactic therapeutic safety and effectiveness in transplant patients, assess mental health impacts of COVID-19 on immunocompromised patients and families, and develop strategies to improve well-being, analyze the economic burden and value of prophylaxis and therapeutic options for COVID-19 transplant patients. I'm going to tell you a little bit about how we got to these objectives. Transplant patients have systematically been excluded from all large clinical trials on approved vaccines and therapeutics. And so since vaccines became available, we have been co-designing research with stakeholders, including patients and families. And a number of you are in this room, so thank you so much, to fill these gaps. With funding from Health Canada and our other partners that I mentioned before, we're addressing the emerging issues. We launched the Treat COVID project in 2023. Thank you. Forgot that there's a clicker. Through the engagement process that has taken place over a number of years since 2022, we have taken 3 lenses. So this is how we came about on these objectives. First, we were looking at the clinical perspective. So the different treatment regimens being used in different provinces, often because there are inadequate evidence specific to the transplant population. This has caused real confusion and frustration among patients. For example, who can't access treatment where they actually live, in what other province. Because our project is national in scope, we will be able to compare which approaches are safest and most effective. Okay, great. I'm actually going to go back. Okay. The second lens is from the mental health and well-being perspective for patients and their families. And this was of highest priority for caregivers in particular. It was deemed crucial to better understand the mental health impacts and develop strategies to support families. Third, from an economic perspective, we are looking at the economic burden of COVID-19 in transplant patients and their caregivers, and the economic value of different therapies, which differ from the general population. These are the types of questions we have been working to answer, and I wanted to give a timeline of where we are. This is our roadmap. So we started in June 2022 with a patient family donor forum, expanding the mental health component. And then at the 2022 ASM, we announced our first funding opportunities. And then in June 2023, we adjusted the priorities to distinguish recipient and caregiver differences. Okay, and last year we got feedback on the communication and recruitment strategy, which we incorporated in our plans, and it's being rolled out as we speak through our national recruitment strategy. What is the Treat COVID update today? Well, I'm happy to announce that of our 12 enrollment sites in BC, Alberta, Ontario, and Quebec, as well as Manitoba, who is recruiting in the study 2B within the treat COVID population. We are open for recruitment at the University of Alberta Hospital and at June, with the remaining sites going to be coming on board in the next 2 months. So I'm really excited to have that happen. We also have our data platform open, and I will put up a QR code so that you have access to that so that you can register to enroll when your transplant site comes on board. So I wanted to talk a little bit about the agenda for today. So it is going to be a more engaging, more interactive session. First, we're going to have Dr. Dima Kabbani talk a little bit about about Treat COVID project and the updates within her transplant center. She's one of the first to be able to enter in the data platform. We're going to have 90 minutes to be able to do this. So we're going to have Dima Kabbani come up, and then Mr. Jad Fadlallah. He's going to talk about mental health among transplant recipients pre and post pandemic. Then we're going to break out into breakout sessions. This is going to happen in person as well as virtually. For the in-person sessions, two groups are going to stay in this room and two groups are going to leave, and I'm going to give more detailed instructions on that. We're going to have one PFD group and one researcher group that's going to stay in here, and one researcher group in the Scion room. So if you joined us for dinner, that's where we're going to meet, and then in the Lime room, which is right beside it. That's the PFD room. So without further ado, I'm going to introduce Dr. Dima Kabbani. She's going to talk a little bit about Treat COVID updates. She is the assistant professor in the Division of Infectious Diseases at the University of Alberta, where she leads Education for Transplant Infectious Disease Fellowship Program. Her clinical and research focus includes infections in immunocompromised patients, particularly in organ transplant recipients and responses to COVID-19 vaccines. And following her presentation will be Mr. Jad Fadlallah, and he is currently a lead research analyst at the multi-organ transplant unit at Toronto General Hospital and has founded a biotech company focused on improving the experience of individuals living with kidney complications. His mission is to improve quality of life by understanding the challenges of individual face, creating solutions to overcome them. And I believe I forgot to introduce myself, so I'll introduce myself now. My name is Geetha Samagalingam. I am the research manager at CDTRP, and I have over 15 years of research experience, and I'm really excited to be leading this project nationally. So thank you so much for joining, and I will hand it over to Dr. Dima Kabbani.
Thank you, Geetha, for the introduction, and good morning, everyone, virtually and in Calgary. Can I just make sure that you can see my slides and hear me well?
Yes.
Okay, perfect. So what I'm going to try to do is just take you through a lens on what has been done at the University of Alberta since we were able to access the platform, and some of our very preliminary data that just show some of the demographic of the patients and family members or caregivers that have been enrolled. So these are my disclosure, nothing related to today's talk. So this is the online platform that is built by the Ottawa Medical Center. And so if you're a patient or a caregiver, this is after you would either by an email have access the site, or to a QR code, you will get to such a page. And then after enrolling, patients can include the information when they have time, and then have different time points where they could be able to enter the information. And these are basically through questionnaires. And then research coordinator at different center will also be able to enter some more information about the solid organ transplant or stem cell transplant that are enrolled in the study, once they know that that a patient or a caregiver was enrolled in this study. So since the platform has been online, which was September, we had 74 adult solid organ transplant and 16 caregivers actually input information in their platform. So they've consented online and they've started answering some of these questionnaires. Some of our because the online platform took some time to be launched, some of our patients we had consented before, and we have entered their information after we have reached to them to ensure that this study was still something that they want to enroll on. So what's interesting when we've asked the solid organ transplant and the caregivers how they heard about this project, 65 of them answered, and the majority said that it was through a transplant physician or a coordinator. I would say that some of it is through email, not just by hearing about it, because the email that was sent by our center was through the transplant program. So I think that's why most of them answered through transplant physician or coordinator. One individual answered that it was through an email, and one individual knew about the study from the CDTRP website. So if we look at the organ group, it's very nicely divided. So I'm happy to see that we have kidney transplant, liver transplant, lung or lung heart, around 25% each. Heart transplant is 16%, and we've had one or two kidney pancreas or kidney pancreas, and even some islet transplants. If we look, when do these individuals have been transplanted? So you see less patients have been transplanted before 2010. The majority are between 2011 and 2019, but we have some more recent transplant. And the reason I divided this number is this is pre-pandemic and this is during the pandemic, and this is post-pandemic. So if we look together at some of the demographic, and we're collecting a lot of demographic, and I know it's a lot for our transplant patient and caregivers that are inputting these information in the questionnaire, but that's actually gives us very important information. So the median age of those that have enrolled in the platform is for the solid organ transplant is 59, their caregiver is 58. Male sex is in 65% of the solid organ transplant. Caregivers are most of them are female. When we've asked questions about gender, so we have 63% men, 35% identify as women, and we had one individual identify as two-spirited, and one individual that did not want to answer. What's also nice is that that is our Canadian population. So we have a different race. The majority is a white North American individual, but we have Indigenous, white European, Southeast Asian. So it's nice to see. And then the majority that have participated so far, not the majority, 50% are retired, but we have 20 to 30% individual that have full-time employment or part-time employment. So diving a little bit into the COVID-19 prevention. So the majority, so 73 out of 74 individuals have received at least 2 COVID vaccine, and the caregivers, 11 out of 16 had received at least 2 COVID-19 vaccines, and there are 3 that did not answer. But it's nice to see that we would like to hear about from in this study about from everyone, right? Not just SOT or caregivers that have received the vaccine. So it's nice to see that we've had patients enrolled, even though they've not had any vaccine, so we can hear their perspective too. Evishield was a monoclonal antibody that was offered to some transplant early in the pandemic. And so we are also looking at that. And so around 22 individual had received the Evishield. When we've asked a participant in the study if they've ever experienced COVID-19 before joining the study, and I'm sure no one is surprised on this call, the majority have had at least one COVID since 2020. Some have had 2 episodes, as you can see in orange, and even some solid organ transplant had more than 2 COVID even before joining the study. Similar to the caregivers, so 14 out of 16 had had COVID before joining the study. And what we're trying to see is whether COVID or any other respiratory infection, how it affects our participant after they join. And so if they get respiratory symptoms and they test for COVID, then it will take them through a different timeline, so they can tell us more about their symptoms, their mental health, if it or if they've have symptoms of long COVID. So so far, since patients have joined, 3 solid organ transplant have had COVID. Only 2 have been symptomatic. Everybody, only 2 have received remdesivir, and we have not seen any hospitalization. So I'm gonna stop here. This is the U of A team that has done all the work that I am presenting, and I want to acknowledge all funding for this study that we have received and continue to receive.
Hello, everyone. Today we will be discussing a study that we did at UHN titled Emotional Distress and Physical Function Post-COVID-19 Pandemic Onset in Solid Organ Transplant Recipients. In the first few years after transplantation, the prevalence of anxiety or depression, which we can combine into emotional distress, ranges from 20 to 60% depending on the transplant center. And the prevalence of physical function impairment is around 50%. And this is data before 2020. These numbers are important and relevant because impaired functioning and emotional distress are independently associated with higher mortality risk and poor quality of life. Now, the stress and functioning are related to how people experience their transplantation journey, and unfortunately, the transplant experience has worsened after the pandemic onset. So recipients had reduced access to physiotherapists and mental health support. And importantly, they are at a high risk of COVID infection and complications because they're immunocompromised, which can lead to fear and less ability to move around. So if physical functioning and distress are related to the experience and the experience has worsened, an important question becomes, are there patterns of worse emotional distress and physical functioning after the pandemic onset, so after 2020? Our aim is to explore these patterns using the patient-reported outcomes measurement information system, the PROMIS, anxiety, depression, and physical function domains. Now, to do that, we will conduct a secondary analysis using data that we have from PROMIS validation studies. These studies included adult transplant recipients that were recruited more than 30 days after their transplant, but they were excluded if they had severe acute illness, dementia, or were non-English speaking. So this is how recruitment looked like. So from 2016 to 2018, we recruited kidney transplant patients only. In 2019, this was extended to kidney, pancreas, and liver. In 2020, recruitment was paused because of the pandemic, and in 2021, it was resumed, including all 3 organ types. So to give you a better idea of the data sources and the measures that we use, so let's say patient A is doing a clinic visit in 2018. They had their transplant in 2017. So in 2018, we collected their PROMIS at one time point only. So this is important for this study. And their sociodemographic were self-reported, and clinical data was extracted from health records. And so this patient would be added to our database. The same thing would happen to another patient, patient B, who is visiting the clinic in 2022, and similarly, PROMIS would be collected at one time point only, so PROMIS anxiety, depression, and physical function for this study. Now, because we have this one time point only data from independent cross-sectional samples across time, one thing that we could do is a repeated cross-sectional study, or something that we could call pseudo-longitudinal. So for instance, everyone that we have assessed before 2020 will serve as a reference of pre-pandemic levels of anxiety, depression, and functioning, and will be grouped into the pre-group. And this group will be compared to two different and relevant groups of transplant recipients after 2020. The first group is the post one, and those are people who are navigating the stressors related to the pandemic, but they are actually established transplant recipients. So they received the transplant in 2019. Another group is the post two group. So not only they experienced the pandemic-related stressors, but they also had to go through transplantation and recovery after 2020, which could lead to more anxiety and more stress and less functioning. So with this in mind, I will keep a reminder on the bottom right that the post two are those transplanted after 2020. So we start with the sample characteristics. Now, one thing that we notice here is that between the three groups, there's a difference in the distribution of organ replacement type. So specifically, we see a higher proportion of kidney transplant in the pre-group before 2020, and this is because of changes in recruitment strategies as we saw in the methods. And this could be related to the differences we see in comorbidities and diabetes, because the post one and post two have a higher proportion of kidney, pancreas, and liver, which are known to be relatively more sick. And then another difference is that the post one is more likely to be slightly older, have higher education, higher hemoglobin, and more likely to be white. Now, these differences that we see in this table are important to adjust for in our subsequent analysis. So we first start with physical function. On the y-axis, you could see the adjusted mean scores of PROMIS physical function with the confidence intervals. And these scores are adjusted for organ type, as you see here, many sociodemographic variables, comorbidities, time since transplant, hemoglobin, and diabetes. And on the x-axis, we see the different groups. Now, for PROMIS physical function, lower scores indicate worse functioning, and 50 is the average of the US general population. So if we first look at this pre-group here and we compare it to the established transplant recipients assessed after 2020, we see that there's no difference between these two groups. However, these two groups are different from the post-two groups, from those transplanted after the pandemic onset. And if we take a closer look at the scores, we see that the post-two has an average PROMIS physical function of 43.8, so lower than the three groups, than the two other groups, as we see in these comparisons here. So this indicates that being transplanted after the pandemic onset is associated with lower physical function. And then we move to anxiety. So for anxiety, the interpretation of the scores is different. So in this case, higher scores indicate more symptoms. And we have our three groups, the pre, the post one, and the post two. So similarly to physical function, we see that the post two group has higher anxiety compared to the pre group. However, interestingly, we see that the post one group stands somewhat in the middle. It's not different from both. So we can see the pairwise comparisons here. This group is not different from both. And this looks like a graded difference across pandemic exposure. And this could make sense because this group is still going through the pandemic and they are still immunocompromised, which could lead to stress. And finally, we look at depression. Now, in depression, higher scores indicate higher symptoms like anxiety. But in this case, we see that all three groups are somewhat similar to the US general population, and they are importantly not different from each other, even those who are transplanted after the pandemic onset. And if we take a closer look at the scores here, we see that they are not different. So solid organ transplant recipients transplanted after the pandemic onset presented more anxiety symptoms, similar depression symptoms, and worse physical functioning compared to pre-pandemic levels. And this makes sense because when we think about the threat of the virus, it is more of an acute stressor and is more related to anxiety than to depression. And then for physical functioning, after 2020, in the beginning, so from 2020 to 2022, we saw that there's less opportunity to access a physiotherapist to walk around, and this could lead to worse physical functioning. So future research should explore support for solid organ transplant recipients during crisis situations. And that was it. Thank you. So I was supposed to talk about only mental health, but then we also added physical function because we thought it was very important. Thank you.
Now that we've heard from both our speakers, we're going to be breaking out into breakout sessions in person as well as virtually. And we ask that everyone to self-select the breakout room in person or virtually based on who you identify with. If you're a patient, family, donor, or a researcher, investigator, clinician. So we're actually going to keep all the in-person breakout rooms in this room. And each of the four corners are going to turn into a breakout session. So in this corner, we're going to have group number, I'm starting with group number 4. It's a researcher session. It's going to be facilitators, Dr. Isfan Mucci, and note takers, Chloe. So if you two can present yourself here, and then researchers and clinicians can meet you there. We're going to have a PFD group over here. And that will be facilitated by Sean Delaney and Jihan Lalani. I'm just going to grab your note, your flip chart. And then we're going to have one in that corner, and that's going to be Rank. That's the one, Erica, that's the one that Rank's going to use. Yeah. Okay. Oh, okay. Okay. For our virtual participants, we are looking for a balanced number of participants in each group. So you may be moved to another room just to even out the numbers. So the possibility is there. I will give a call at 5 minutes for everyone to return here so that we can have Dr. Kednapa Thavorn present her research as well. So hopefully everyone got those instructions straight. I can repeat them once more. So yeah, so Patricia's going to be in the back. She's going to be leading the researcher group. Okay, so everyone that is a researcher, clinician, investigator that comes out here. Can I have the next slide up? Okay, great. So as soon as everyone gets settled, I can talk a little bit about the breakout room questions. Okay, great. I hope our virtual participants have gone into their breakout room as well.
No, we have not. We're still all here.
We do have one virtual room for Francophone speakers, for French speakers. It is a mixed group of PFDs and researchers. You're welcome to join that. Julie will be facilitating.
Geetha, can you hear us?
Just wanted to give you an update on the breakout room questions. So for PFT groups, we're going to be looking at the side that is most left to me, I guess. And what conversations are you having with your family or healthcare team about COVID and other viruses like the flu? What barriers are there to talking about research and COVID to your family members, caregivers, and healthcare team? And number 3 is what would make that conversation easier? If you're a clinician, researcher, group, you're going to be talking about what conversations are happening between you as a clinician, researcher, and transplant recipients, family members, and caregivers about COVID and other viruses like the flu. And number 2 is what barriers are there to talk about research and COVID to patients and families and caregivers. And number 3, what would make that conversation easier? So I'm going to start time now. I will give you 5 minutes to come back to the room. So I'll announce that. Thank you so much. Okay. We're gonna, sorry to be interrupting these great conversations, but I think it's time to get everyone back into the main room. So all our virtual participants will be coming into the main room from their breakout session. And if all of our in-person attendees can turn their attention towards the slides that we will be presenting. I'm sorry, Dr. So next we have Dr. Kednapa Thavorn, but I did want to make a note. I know there's usually a presentation of the discussion that happened, but unfortunately due to time constraints, we only have 90 minutes. We're actually going to move on to our next presentation. And all of these responses and all this great rich discussion will be presented in a report that will come out in a few weeks, and we will have that sent out to all of our to our mailing list. So please look forward to that. Please have a read of it because your points are definitely captured there. So without further ado, I am going to now announce our next presenter, Dr. Kednapa Thavorn. Just going to So those are some great breakout sessions. I heard a few amazing challenges that were brought up, some of them due to employment and accommodations that are needed as a transplant recipient. I heard some things like, the pandemic is over, but COVID hasn't left yet. So amazing discussions. Thank you so much for attending again. We're going to change gears and hear from Dr. Kednapa Thavorn on health economics of COVID-19 prevention and treatment options for transplant recipients. And here is a very short bio. Dr. Thavorn is a senior scientist and scientific lead of health economics at the Ottawa Hospital Research Institute. She is also an associate professor with the School of Epidemiology and Public Health at the University of Ottawa. Her research focuses on health economics, health technology assessment, pharmacoepidemiology, health equity, care for people of complex needs, and population health. And this falls rightly within that intersection. So please, everyone, give a hand for Dr. Thavorn.
Thank you very much, Gita, for really kind introduction, and very nice to meet you here. I don't have any conflict to disclose. So I have very simple objective today in terms of I want to make sure that we are on the same page in terms of what do I mean by health economics. And then I want to share a very interesting, exciting study that we have, the Treat COVID team has been doing in terms of the cost effectiveness of the prophylaxis and also treatment intervention for transplant recipient. So in order to make sure that you with me and see that it's important, let's go through these kind of mental exercise and thinking about if you actually were asked to be a health minister. And that particular day that you get promoted to become a minister, you get the question to ask, will you actually fund a province-wide telemedicine or telehealth for kidney transplant recipient? So congratulations, but this is your first task and your first job. So difficult, but before that, I actually give you more information what this particular telemedicine actually entail. It is a program that includes digital and remote healthcare services that lead to actually improve post-transplant care, facilitate pre-transplant evaluation, addressing unique needs of the patient, and it's include the services that involve monitoring, medication, management, and education. Now is your turn. So what else you need to know in order to make these challenging decision or maybe fun decision? Anyone want to raise a hand in terms of what do you want to know? Okay, I have 10 minutes. Gita is just looking at me. Okay, so typically what you would say it's going to be, I really want to know whether that particular program is actually really good, provide really good service, good quality, because I don't want anyone to go to the service that's considered bad. The second thing is like, I want to make sure that there's no unintended consequence. It should be safe. And the third thing is like, I want to make sure that it works in terms of like, it addresses my needs in terms of what I want to do, whether it's in terms of improve quality of life, reduce the wait time, and improve services. And the other thing that it's hidden that you may see that, oh, now I know why Kednapa is here. I also want to know how much does it cost in order to actually cover these particular services. So that's why person like me get a job. And we're talking about health economics. Health economics is actually we trying to looking at how to allocate limited resources. So like with healthcare budget that limited, when we spend on something, it would mean that we spend less on something else because like we can't really pay for anything. And this kind of decision making, it's happen every day. And in economics, we call it as like opportunity cost. It happened to us every day, as I said, like we have to think about with our time, should I actually attend Kednapa talk to learn about health economics? Or the other thing is thinking about like healthcare system as well, what to fund and not to fund. With this kind of like limited resources, choice needs to be made. And in terms of like coming back to like transplantation, like we all agree that like transplantation is resource intensive, and it requires a lot of resources in terms of like procurement, surgery, medication, and also follow-up care. And in order to ensure that we actually could have sustainable healthcare system, so we would need to make sure that there's a systematic way to looking at cost and benefit of that kind of intervention. And an example of intervention, yesterday we have a lot of great discussion talking about different type of intervention, but to name a few, it could be like telemedicine in terms of one of the tasks you'd receive at an early session, and then like there are different type organ delivery, and at the same time, there's a lot of hype in terms of AI scoring system, try to ensure that we find a perfect match for transplantation. So one of the ways that we can help people to think about cost and benefit more systematically is to use the technique called health economic evaluation. So it has very simple feature in terms of first, it has to looking at least two healthcare intervention. As you see in the schematic on the left-hand side there, like it's at least two healthcare intervention. And then it has to looking at cost and benefit, like the cost we know that it potentially could be financial cost and could also be any other intangible costs, like in terms of emotion and also like anxiety and mental health, those kind of aspects as well. And in terms of outcome, an example would be like quality of life and also like day that you can like reduce the day that you can actually return to work. And that is like the very simple way of thinking about what do I mean by health economic evaluation. And now I assume that you are with me in terms of when I'm talking about economic evaluation, what that it means. And I'm going to share with you the two exciting and important work that Treat COVID team has been doing. So the first project is a review. We're looking at like existing evidence in terms of published study, in terms of what has been done when it comes to the cost effectiveness, economic evaluation of like prevention and treatment option for transplant recipient. We're looking at all public literature, looking at like 4,000 of them. And of those, we identified 39 studies that looking at preventive and treatment option for anyone who like thinking about this kind of like scenario. But of those 39 studies, only 5 studies that either include or focus on transplant population. And of those that looking at transplant population, there are 2 categories in terms of prevention. We're looking at like there's one study that looking at Evershield, and then another one that looking at monoclonal antibodies. And then it showed that like these kind of prevention, therapeutic prevention strategy, it's more expensive. At the same time, it also improves health outcome. So what it means is that looking at that in general, like policymaker, decision maker have to pay about like $20,000 to about $74,000 in order to improve one type of outcome. And in this kind of outcome, it's called quality adjusted life year. Is the year that people live and also have a really good quality of life. So that's why we call quality adjusted life year. looking at the treatment, there are like three type of treatment that's being evaluated. So it's been like, I think, remdesivir, molnupiravir, and fluvoxamine, in which like it's showing that the range of that particular like cost per benefit, it's range between, it could be cost saving or at the same time more expensive, and also improve health outcome. So what we highlight is just like it's really a high variation in terms of the cost and benefit, and at the same time, it also depending on like the type of population and the indication of those treatment as well. So based on that, it lead to the work of the second project that what we need your help for the subsequent breakout session, where what we try to looking at what are the cost and benefit or the cost effectiveness of like Paxlovid, and to see whether like the benefit gain from these particular treatment justify the cost among transplant recipient. And what we try to looking at is just like looking at the cost. It's not just what born to the healthcare system. For example, majority like in Canada, it's cover like hospitalization, physician, and part of medication. But we also want to looking at from patient and family and donor point of view in terms of other potential costs and sacrifice that you have been experienced. And that analysis, we want to make sure that we co-produce and at the same time working with patient, family, and donor to make sure that we take your point of view and take the patient journey to make sure that we get the meaningful result. So my task today, as I said, just to convince you that when we're talking about health economics, it's not the same as accountant. So what we're looking at is actually the value of the intervention, and you can help us to actually make sure that the analysis and the work that we're doing with Treat COVID and with CDTRP is actually meaningful and it resonates with your value. So, and I am looking forward to like your involvement and at the same time, any question that you may have. So I want to end the presentation by to thanks like CDTRP and also our funder and also the whole Treat COVID investigator. And last but not least, thanks everyone for your attention.
That was speedy. Thank you so much, Dr. Kednapa. So we are going to go on to breakout number 2. Again, it's going to be about 20 minutes. I'm going to give a 5-minute call. And I just wanted to put up the question. Ooh, is this the number 2? Yes, it is. So these are the breakout session questions on the slide for the in-person attendees. The virtual attendees, all of the virtual breakout room facilitators and note takers will have them up for you. And I was hoping you guys could just go back for the in-person attendees, into the breakout sessions that you were already sitting in. And again, please refer to these questions. What are the important costs and sacrifices that come to mind when you think about COVID prevention and treatment options? What benefits or results matter most to you when deciding if COVID-19 prevention or treatment option is right for you? And would the costs and benefits you mentioned be similar for other types of post-transplant care beyond COVID-19 prevention or treatment? So I'm going to let everyone go back to their previous breakout session, and we will continue the discussion. Thank you so much. I'm going to have everyone turn their attention towards the slides. Again, we're really just wrapping up. Thank you so much for the rich discussion. I heard some amazing challenges that patients are facing, their families are facing. So I hope that you were able to let your note takers and facilitators know so that it was captured in the notes. We're going to disseminate that report as soon as we get back to our offices. So please look out for that in the next little while. I just wanted to highlight everyone on the national team, because Treat COVID and the National COVID Prioritization Forums would not be taking place without these members of our team, our Alberta team, our British Columbia, our Manitoba, our Quebec, our Ontario. And I want to highlight our patient and family partners, Rank in the back. Thank you so much. And Sherry, who's online, thank you so much for co-leading and giving us the type of feedback, the rich feedback that we're able to make sure that we're considering everything in the study. I also put in our CDTRP team. And last but not least, this is our QR code to the data platform. So if you are a recipient or a caregiver, please consider enrolling in the study. And we are open at the University of Alberta Hospital as well as CHUM, and the other transplant centers will open in the next couple of weeks, months. I think within the next 2 months, we're going to have everyone open. So please consider going on the data platform right now, signing up so that you receive notification of when that transplant program is open. As well, you can click on the link, the bit.ly link that's in the chat. I believe all virtual participants have that. And then my email as well as our general email. And please follow us on all of our social media sites so that you know when your transplant program opens and any updates on the Treat COVID study as well. Just want to say a big thank you to everyone that's in this room, as well as everyone that's virtually attended our session. Please consider joining the study and look forward to seeing you next year. Take care.